Kevin Kavanagh, Health Watch.
Thank you very much. Prevention of the spread of MDROs has been dealt with only superficially and mostly in the context of detection and control of poorly defined outbreaks. Some drug-resistant bacteria, such as MRSA, has become endemic in our general population. MRSA has also become more virulent, such as the emergence of the strain USA 300. Knowing rates and identifying carriage is of utmost importance in stopping this epidemic. Containment will be expensive, and what I am afraid has happened is that the safety of patients is being relegated to the facility's bottom line. The strategy of destroying microbiomes of chlorhexidine makes little sense. Chlorhexidine is a complex 22-carbon atom compound that is classified as an antiseptic as opposed to an antibiotic because it has such a wide spectrum. It is a contradictory policy to advocate for antibiotic stewardship and the use of narrow-spectrum antibiotics, but at the same time advocate for daily use of total body bathing with chlorhexidine. Hand washing should be viewed as a very important component of an infection prevention bundle. But in the context of multi-drug resistant organisms, it is a backup measure, since these organisms should not be on a healthcare worker's hands in the first place. And if they are, there is a problem with containment and control and the identification of carriers. All but ignored are the over 18 million healthcare workers in the United States. Multiple studies have reported the MRSA carriage rate of healthcare workers to approximate 5%. A recent study by Chin et al. Confirms previous research regarding rapid environmental spread of MDROs. The lack of firm standards as policies is placing healthcare workers, along with their patients and families, at risk for acquisition of these dangerous pathogens. At a minimum, we need routine testing to identify carriers and a standardized national reporting system for healthcare worker acquisitions, along with an economic safety net for those workers who acquire these dangerous pathogens. Some actionable steps that this council could take would be the further consideration of the importance of identification and decolonization of MDRO carriers in stopping this epidemic. Consideration of having a section at a future meeting devoted to healthcare worker safety with presentations from a wide variety of stakeholders. The possibility of having the CDC adding a field to their EIP surveillance network to designate healthcare worker acquisitions and infections from MDROs, and to recommend the removal of over-the-counter analogs of colistin from household medicine cabinets. These organisms do not respect standards, academic degrees, and notoriety. They're evolving, getting stronger, and are out to win. The epidemic of drug-resistant organisms represents an important turning point in medical history, similar to the discovery of the cell theory and invention of antibiotics, and is a disastrous threat to our ability to treat patients. 200 years from now, your decisions will be studied and dissected by others, and your legacy will then be submitted for eternity. I encourage you to make bold and specific recommendations to stop this epidemic. Thank you.